Hello and welcome. Today we're diving deep into attention deficit hyperactivity disorder, or ADHD. We'll explore what ADHD is, what causes it, how it affects the brain, and what can be done to help those living with it. So, let's begin unraveling the complexities of ADHD. The exact causes of ADHD remain somewhat elusive, but it's generally accepted to be a complex interplay of genetic and environmental factors. Research strongly suggests a significant genetic component, meaning ADHD tends to run in families. Genes involved in dopamine and norepinephrine transport and signaling are often implicated. Environmental factors, such as premature birth, low birth weight, exposure to toxins like lead during pregnancy or early childhood, and even maternal stress during pregnancy, may also increase the risk of developing ADHD. It's important to remember that ADHD is not caused by bad parenting, excessive screen time alone, or dietary factors, although these can certainly influence behavior. ADHD is believed to stem from differences in brain structure and function, particularly in areas responsible for attention, impulse control, and executive functions. Neuroimaging studies have shown reduced gray matter volume and altered activity in regions like the prefrontal cortex, basal ganglia, and cerebellum. Specifically, the prefrontal cortex, crucial for planning and focus, often shows decreased activity. The basal ganglia, involved in reward processing and motor control, may also function differently, leading to difficulties in regulating behavior. These neurological differences affect the neurotransmitter systems, particularly dopamine and norepinephrine, leading to disruptions in communication between brain cells and contributing to the core symptoms of ADHD. ADHD is a common neurodevelopmental disorder, affecting children and adults worldwide. Epidemiological studies estimate that it affects approximately 5% of children and 2.5% of adults. Prevalence rates can vary slightly depending on the diagnostic criteria and population studied. It is more frequently diagnosed in males than females, although this may be partly due to differences in presentation and recognition of symptoms. It's important to acknowledge that ADHD is a global phenomenon and not limited to any specific cultural or socioeconomic group. The hallmark symptoms of ADHD are inattention, hyperactivity, and impulsivity, but these manifest differently in each individual. Inattention may present as difficulty sustaining focus, being easily distracted, struggling to follow instructions, losing things frequently, and seeming not to listen when spoken to directly. Hyperactivity can involve excessive fidgeting, difficulty staying seated, running or climbing inappropriately, and talking excessively. Impulsivity may manifest as blurting out answers, interrupting others, difficulty waiting their turn, and acting without thinking. These symptoms must be persistent, present in multiple settings e.g. home, school, work, and significantly impair daily functioning to warrant a diagnosis of ADHD. Diagnosing ADHD is a multi-faceted process that typically involves a comprehensive evaluation by a qualified healthcare professional, such as a pediatrician, psychiatrist, or psychologist. There isn't a single definitive test for ADHD. The diagnostic process typically includes gathering information from multiple sources, such as parents, teachers, and the individual themselves. Standardized questionnaires and rating scales are often used to assess the frequency and severity of ADHD symptoms. A thorough medical history and physical examination are also crucial to rule out other potential medical conditions that could be contributing to the symptoms. The diagnostic criteria outlined in the Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, are used to guide the diagnostic process. ADHD is often classified into three main types, although some experts now prefer a dimensional approach. These types are primarily inattentive presentation, where inattentive symptoms predominate, primarily hyperactive, impulsive presentation, characterized by primarily hyperactive and impulsive symptoms, and combined presentation, which involves a combination of both inattentive and hyperactive impulsive symptoms. The specific presentation can evolve over time, and some individuals may transition between types as they age. Treatment for ADHD typically involves a combination of medication and behavioral therapy. Stimulant medications, such as methylphenidate and amphetamine, are often prescribed to help improve focus and reduce impulsivity. Non-stimulant medications, such as atomoxetine and guanfacine, are also available. Behavioral therapies such as cognitive behavioral therapy as CBT and parent training can help individuals develop coping skills, manage their symptoms, and improve their overall functioning. Educational interventions, such as individualized education programs (IEPs) in schools, can also provide support and accommodations to help children with ADHD succeed academically. A comprehensive and individualized treatment plan is essential for managing ADHD effectively. Currently, there isn't a guaranteed way to prevent ADHD, given its complex etiology. However, certain measures can potentially reduce the risk. Promoting healthy prenatal care, including avoiding exposure to toxins like lead and minimizing stress during pregnancy, is important. Encouraging healthy lifestyle habits, such as a balanced diet and regular physical activity, in children may also be beneficial. Early identification and intervention can help mitigate the impact of ADHD on development and well-being. The prognosis for individuals with ADHD varies. With appropriate treatment and support, many individuals with ADHD can lead fulfilling and productive lives. However, without intervention, ADHD can significantly impact academic achievement, social relationships, and occupational success. Recent research is exploring novel treatments, including neurofeedback and digital therapeutics, as well as further investigating the underlying neurobiology of ADHD to develop more targeted interventions. Continuous research efforts offer hope for improving the lives of individuals with ADHD and their families.